It might surprise you, but just like us, our dogs and cats can get urinary tract infections, often without us even realizing it.
That's absolutely right. We tend to think of UTIs as mainly a human thing, but yeah, they're a really common issue in pets.
So in this deep dive, we're tackling bacterial lower urinary tract infections in animals.
hmm
We've got some excellent information pulled from bacterial lower urinary tract infection in animals.
A solid source.
And our mission really is to unpack the crucial bits for you, the listener. We want you to understand what UTIs are in pets, why they pop up, how vets figure them out.
And what can be done?
Exactly, and what can be done without getting lost in all the, heavy medical jargon.
hmm
And helping us sort through this is our expert.
Happy to be here. Let's dive in.
Okay, great. Let's start right at the beginning. What exactly is a bacterial lower urinary tract infection in a dog or cat?
Well, put simply, it's when bacteria manage to adhere to stick to and then multiply inside the urinary bladder.
Okay, stick and multiply. So what normally stops that from happening? Our pets aren't getting UTIs constantly.
No, definitely not. The body has several layers of defense. First, there are anatomical, sort of physical barriers and functional ones that prevent bacteria from just traveling up the urethra.
Okay.
Then, normal urine itself actually has antibacterial properties. It's not a friendly environment for most bacteria.
Interesting.
And finally, you've got the immune system, both the local defenses in the bladder lining, the mucosa, and the body's overall systemic immune response.
So a UTI happens when one or more of those defenses get, well, breached.
Exactly. If those defenses are impaired somehow, bacteria can get a foothold. They colonize, maybe in the urine itself, or attach to that bladder lining, the
The
urothelium.
urothelium, right.
And that presence triggers an inflammatory response from the bladder lining.
And that's what causes the symptoms we might notice, the inflammation.
Precisely. That inflammation is what leads to things like dysuria, that's painful or difficult urination, pollakiuria, which means they need to pee really frequently, often just small amounts,
Mm-hmm.
and hematuria, which is blood in the urine.
Gotcha. And just so we're clear on the body system we're talking about here.
This is all happening within the renal urologic system, so kidneys, ureters, bladder, urethra.
Perfect. Now, how common are these infections? It feels like something you don't hear about constantly from pet owners.
Well, the overall prevalence isn't super high in generally healthy animals, but it becomes much more relevant, much more common when animals have certain predisposing conditions.
Okay, so break that down for us. What about dogs?
Sure. So in dogs without any urinary tract signs, the prevalence is pretty low, maybe around 2%.
Right.
But if you look at dogs with diabetes when they're first diagnosed, that jumps to about 7.7%.
Wow, quite a leap.
It is. And if a dog has had diabetes at any point, the chance they've had a UTI is much higher, around 37%.
37%. Okay. What other conditions increase the risk in dogs?
Another big one is hyperadrenocorticism, or Cushing's disease. At initial diagnosis, almost half, 46% of dogs with Cushing's might have a UTI.
Nearly half. That's significant.
It really is. Then you have things like certain back problems, thoracolumbar intervertebral disc extrusion.
Yeah.
The risk there is maybe 20 to 38%.
Okay.
And here's a really stark one. Dogs that need an indwelling urinary catheter while hospitalized. The prevalence is incredibly high, like 63.8%.
Over 60%. That makes sense, though, doesn't it? The catheter just provides a direct route.
It absolutely does. It bypasses many of those natural defenses we talked about.
So what about cats? Are they in the same boat, or is it different?
Generally, cats seem to get UTIs a bit less frequently than dogs overall. For healthy cats without any lower urinary signs, it's very low, maybe just under 1%.
Okay.
But if a cat is showing signs of lower urinary tract disease, then the chance of finding a bacterial UTI goes up somewhere between 3.4% and 12%.
Still lower than some of those dog stats, but definitely higher if they're showing signs.
Right. And similar to dogs, underlying conditions matter in cats too.
Such as?
Well, cats with ureteral calculi stones in the tubes from the kidney to the bladder have about an 8.4% prevalence.
Mm-hmm.
If a cat has chronic kidney disease, the risk jumps significantly, somewhere between 17% and nearly 30% over their lifetime.
Wow, kidney disease is a big factor then.
It is. Diabetes in cats also increases risk, around 12%, and uncontrolled hyperthyroidism, maybe 12% too.
Okay.
And one more cats that have had a specific surgery called a perineal urethrostomy, they have about a 22% chance of getting a UTI at some point after the surgery.
So sewing that up, UTIs happen in both but maybe more common territory for dogs, especially dogs with those underlying issues we mentioned.
That's a fair summary, yes.
What about age or sex? Does that play a role?
Well, UTIs can occur at any age, really. In dogs, the average age we see them is around 7 or 8 years old, and the risk does tend to increase as dogs get older.
Okay, older dogs more at risk.
Yeah. For cats, the median age is similar, around 7 or 8 years, but the range is huge from kittens just a few months old up to very senior cats.
And males versus females?
In dogs, females are definitely more commonly affected than males.
Ah, okay.
But in cats, it seems to affect both sexes roughly equally. No strong sex predisposition there.
Interesting difference. Okay, so we know what they are, who gets them.
Yeah.
How do we, as owners, actually spot one? What should we be looking out for?
That's key because sometimes pets can have a UTI and show absolutely zero signs. They're asymptomatic.
Right, which makes it tricky.
It does, but when there are signs, they can vary quite a bit in severity.
So what are the classic things we might notice at home?
You might see that frequent urination, polyuria, needing to go constantly, maybe just dribbling,
Okay.
straining or showing discomfort while peeing. That's the dysuria.
Painful, yeah.
Seeing blood in the urine, the hematuria. Sometimes they might seem really urgent, like they have to go right now, which can lead to accidents even in house-trained pets.
Right.
You might also notice them licking their genital area more than usual, or maybe see some discharge.
Those all sound like definite warning signs. What about general sickness? Like, do they get fevers or go off their food?
You know, typically with these lower UTIs, the uncomplicated ones, systemic signs like poor appetite or lethargy are actually pretty infrequent. The signs tend to be focused on urination.
Okay, that's good to know. So if we take our pet in, suspecting a UTI, what might the vet find during the exam? Anything obvious?
Often the physical exam can be surprisingly unremarkable, pretty normal.
Huh.
But sometimes when the vet palpates or feels the bladder, they might notice some abnormalities.
Like what?
Maybe the bladder wall feels thickened. Sometimes they might feel a kind of crackling sensation called crepitus. Occasionally, just touching the bladder might make the pet urinate regardless of how full it is, or they might react like it's painful.
Okay, so subtle signs potentially on exam. Now let's dig into the why. What actually causes these bacteria to invade? Where do they come from?
The vast majority of the time, it's caused by bacteria that normally live harmlessly on the pet's skin or on their mucous membranes or in their gut. These are called commensal bacteria.
Commensal, so normally, okay.
Right, but somehow they manage to ascend or travel up the urethra and into the bladder where they don't belong.
And are there usual suspects? Particular types of bacteria?
Oh, definitely. When vets run urine cultures to identify the bacteria, over 99% of the time they find aerobic bacteria, the kind that need oxygen.
Got
And
it.
in most cases, maybe 75 to 95%, it's just a single type of bacteria causing the trouble.
One main culprit.
Usually. And the most common ones, responsible for about half of all cases, are Escherichia coli, E. coli,
Yeah, I heard of that one.
different species of Staphylococcus, and Proteus species. Those three are the big players.
E. coli, Staph, Proteus.
Got it.
Are there others?
Yep. There's a group of about 8 bacterial species that collectively account for roughly 95% of UTIs. Besides those top 3, you also see Streptococcus, Klebsiella, Enterococcus, Pseudomonas, and Corynebacterium.
Okay, so a relatively limited cast of characters, mostly.
For the most part, yes.
We touched on underlying conditions making pets more prone. Can we elaborate on those risk factors a bit more? What really lowers their defenses?
Absolutely. One major factor is systemic immune dysfunction. Basically, if the pet's overall immune system isn't working at full strength.
Like with Cushing's disease you mentioned.
Exactly. The suppressed immunity in dogs with hyperadrenocorticism makes them much more vulnerable to infection.
Makes sense.
What else? Another big one is the presence of something that acts as a nidus. Think of it like a foothold or hiding place for bacteria.
A nidus, like a little anchor point.
Sort of, yeah. It allows bacteria to stick around and evade the body's defenses. Indwelling urinary catheters are a prime example.
Right, the direct pathway.
And uroliths, bladder stones, are another common nidus. Bacteria can kind of hide in the crevices of the stones.
Ah, okay. Bladder stones.
Then there are changes in the urine itself. If the urine is persistently very dilute, it loses some of its natural antibacterial effect. And glycosuria, glucose or sugar in the urine, like with diabetes, basically provides food for bacteria, helping them thrive.
Like a buffet for bacteria.
Got it.
Gotcha. What about the plumbing itself, the structure?
Yeah, absolutely. Anything that compromises the normal barriers stopping bacteria from moving backwards up the urethra is a risk factor.
Like what kind of things?
Maybe a loss of normal muscle tone in the urethra, or anatomical issues like ectopic ureters, where the tubes from the kidneys don't connect to the bladder in the right place.
Mm.
Also, anything that leads to incomplete bladder emptying. If urine sits stagnant in the bladder, bacteria have more time to multiply.
Residual urine. Right.
Exactly. And finally, if the bladder lining itself, the mucosa, gets damaged maybe from trauma caused by those bladder stones rubbing against it, that disrupts its defensive capabilities too.
That paints a really clear picture of how different factors can stack up to increase risk. Okay, diagnosis. You said earlier that just seeing the signs isn't enough.
That's right. Those common signs, dysuria, pollakiuria, hematuria, are common to many different lower urinary tract diseases in both dogs and cats. They point towards a problem, but not specifically a bacterial infection.
So you can't diagnose a UTI just based on seeing, say, blood in the urine and frequent peeing.
Nope. You can't confirm it, and you also can't rule it out just based on symptoms. Some pets with UTIs have minimal signs, remember.
Good point. What other conditions mimic UTI symptoms?
Well, the source highlights cystolithiasis bladder stones as a big one. Also, lower urinary tract neoplasia, which is cancer or tumors.
Oh, okay.
And confusingly, both stones and tumors can actually increase the risk of getting a secondary UTI.
Makes it complicated.
It does. And in cats, we have to remember feline idiopathic cystitis, or FIC. It's a common inflammatory condition without a known infectious cause, but the signs look almost identical to a bacterial UTI.
FIC in cats.
Right.
Heard of that. So if symptoms are unreliable, what's the path to diagnosis? The source mentioned uncomplicated versus complicated UTIs earlier. Could you recap that?
Sure. It's a really important distinction for management. An uncomplicated UTI is basically a spontaneous infection that occurs in an animal with an otherwise normal, healthy urinary tract and no underlying factors making them susceptible. Think of it as a one-off random infection.
Okay, simple, isolated case.
Right. A complicated UTI, on the other hand, is one that's associated with some kind of impairment in the host's defenses. Or it happens in pets who keep getting infections defined often as 3 or more episodes within a 12-month period.
3 or more in a year sounds like a lot.
It is, and it signals an underlying issue, usually. Within those recurrent cases, we also distinguish between reinfection.
Reinfection?
Yeah, where the pet has an infection, it clears with treatment, but then they get another infection later caused by a different type of bacteria.
Okay, new bug moves in.
Exactly. Versus a relapse.
Relapse.
That's when the infection seems to resolve, but it comes back, and it's caused by the persistence of the original bacteria that maybe wasn't fully cleared.
Oh, the same one sticking around. Got it. So, back to diagnosis. Are routine blood tests like a CBC or chemistry panel helpful?
Generally not for uncomplicated lower UTIs. Those results are usually pretty unremarkable. They might be useful if we suspect complications like kidney involvement, but not for the basic UTI itself.
Okay, so blood work is usually out. What about urinalysis? Looking closely at the urine.
Urinalysis is definitely a key step, but again, it's not definitive on its own.
What does it typically show?
Pyuria white blood cells in the urine is common, indicating inflammation. But remember, inflammation isn't only caused by infection.
Right.
And those dipstick tests for white blood cells, not very reliable in pets. You get false negatives in dogs and false positives in cats.
Good to know about the dipsticks. What else?
Hematuria, blood, and proteinuria, protein, are also common findings, but again, not specific to infection.
Okay.
Sometimes, if the urine pH is high, very alkaline, it might suggest the presence of certain bacteria that produce urese, an enzyme that breaks down urea.
Urese-producing bacteria, like Proteus.
Exactly. Proteus is a classic example. You might also see struvite crystals in the sediment. These can sometimes form because of a UTI, but they can also be present without infection or absent even when there is one.
So crystals aren't definitive either.
No. And importantly, just seeing bacteria in unstained urine sediment under the microscope is really inaccurate for diagnosing a UTI. It leads to overdiagnosis quite often.
Okay, so urinalysis gives clues, inflammation, blood, maybe crystals, pH changes, but not the final word. What is the final word? How do you confirm it's bacteria?
The definitive diagnosis requires an aerobic urine culture.
Culture. Growing the bacteria.
Exactly. Taking a urine sample and sending it to the lab to see if bacteria grow, what type they are, and how many there are.
And getting that sample is important. You mentioned contamination risks earlier. What's the best way?
The gold standard method for collecting urine for culture is cystocentesis.
Cysto. Remind me.
That's where a sterile needle is passed through the abdominal wall directly into the bladder to withdraw urine.
Right, the needle poke.
Mm.
Sounds a bit intense, but gets a clean sample.
It does. It bypasses the lower urinary tract where contaminants normally live. For a cystocentesis sample, bacterial growth over 1,000 colony-forming units per milliliter, that's 103 cm/ml, is generally considered significant for diagnosis in both dogs and cats.
1,000 cfm/ml from a cysto. What about other methods, like using a catheter?
Catheterization can be used, but there's a higher risk of picking up bacteria from the urethra on the way in. So the threshold for what's considered a significant infection is higher.
How much higher?
For male dogs, it's typically greater than 10,000 cm/ml, 104. For female dogs, it's even higher, usually over 100,000 cm/ml, 105.
Wow, big difference for female dogs.
Yeah, their shorter, wider urethra means more potential contaminants. Interestingly, for cats, the threshold for catheter samples is often still set lower, around 1,000 cfm/ml, similar to cysto.
Okay. Any caveats with catheters?
Definitely. The source specifically warns against sampling from indwelling catheters once left in place because they often get colonized with bacteria that aren't actually causing a bladder infection. And culturing the catheter tip itself isn't considered useful.
Good to know. And what about just catching a sample when they pee? The free catch method.
The source advises against culturing voided midstream samples or urine collected from non-sterile surfaces like the floor or a litter box. The contamination risk is just too high for reliable culture results.
So cystocentesis is really preferred for culture if possible.
It provides the most reliable results, yes.
Okay, so we've cultured the urine. It's positive for bacteria above the threshold. What's the next critical piece of information we need from that culture?
Antibiotic sensitivity testing, sometimes called susceptibility testing.
Sensitivity testing. Why is that so important?
Because it tells us which specific antibiotics are likely to be effective against the particular strain of bacteria that was grown from that pet's urine.
Well,
It guides treatment choices.
makes sense. Don't want to use something the bacteria are resistant to.
Exactly. Especially with concerns about growing antibiotic resistance. This testing helps us choose the right drug.
Okay, perfect lead-in. Let's talk treatment. We've got the diagnosis, we know the bacteria, maybe we know what it's sensitive to. How do we actually treat these UTIs?
Well, for most uncomplicated cases, treatment can usually happen on an outpatient basis. The pet takes medication at home.
Okay.
Inpatient care, hospitalization might be needed if there are serious complications, like the infection spreading to the kidneys or if there's a blockage, but that's less common for simple lower UTIs.
Activity level's usually okay.
Yeah, activity usually doesn't need to be restricted.
Any special diets involved?
Sometimes. If the UTI has led to the formation of infection-induced struvite stones, a special calculolytic diet might be prescribed to help dissolve those stones alongside the antibiotics.
Okay. And overall, the outlook for simple UTIs?
For uncomplicated bacterial UTIs, the prognosis is typically excellent. They usually respond well to appropriate treatment. Surgery might come into play for certain complicated situations, like removing persistent stones or dealing with specific types of bladder inflammation, but not for the standard UTI.
Got it. So the core of treatment is usually medication, specifically antibiotics.
Correct. Antibiotics are the mainstay. Vets often think in terms of first-line and second-line antimicrobials.
First line versus second line. What's the difference?
First-line antibiotics are generally chosen because they have good activity against the most common UTI bacteria. They concentrate well in urine. They ideally kill the bacteria rather than just inhibiting them. And they tend to have fewer side effects and be more affordable. They're the go-to choices initially.
Makes sense. Your workhorses.
Exactly. Second-line drugs are usually reserved for cases where first-line drugs aren't appropriate, maybe based on those sensitivity results showing resistance, or if the infection isn't responding, they might have a broader spectrum, different side effect profiles, or be needed for more resistant bugs.
So if a vet suspects a UTI but is waiting for culture results, what do they typically start with?
In that situation called empiric treatment, they'll usually choose a first-line antibiotic that has a good chance of working against the most likely bacteria, like E. coli or Staph.
Okay, makes sense to start something.
Yes, but the ideal approach, once you have the culture and sensitivity results, is to select the most appropriate, narrowest spectrum, lowest tier antibiotic that the bacteria are susceptible to. We want to avoid using broader or stronger antibiotics unnecessarily.
Stewardship, right? Use the right tool for the job.
Precisely.
Can you give us examples of these first-line drugs and typical dosing?
Sure. The source lists amoxicillin, often given orally every 8 hours, so 3 times a day, and also trimethoprim sulfadiazine, or TMS, usually given orally every 12 hours, twice a day. Dosages are based on weight, of course.
Amoxicillin, TMS.
Okay.
And second-line options.
Second-line drugs mentioned include amoxicillin clavulanate, that's amoxicillin, combined with something to overcome certain types of resistance, usually given twice daily.
Okay.
Also, the fluoroquinolone class of antibiotics, drugs like enrofloxacin, marbofloxacin, orbifloxacin, these are often once-daily pills. And there's also cefavecin, which is a long-acting injectable antibiotic.
Injectable, interesting. Are there third-line drugs for really tough cases?
Yes, for multi-drug resistant infections. Third-line options might include amikacin, which is an injectable, chloramphenicol, which is an oral medication but has potential side effects to monitor,
Right.
and then more potent drugs like meropenem or imipenem silistin, usually reserved for serious resistant infections and often given in hospital. Nitrofurantoin is another oral option, sometimes used for resistant lower UTIs. Dosages vary, and some differ between dogs and cats.
Quite an arsenal available, tiered based on need. How long does treatment usually last?
For uncomplicated UTIs, the standard recommendation has been 7 to 10 days of antibiotics.
Okay, week to week and a half.
Right. For complicated UTIs, treatment needs to be longer, typically 4 to 6 weeks, to ensure the infection is fully cleared, especially if there's an underlying issue.
4 to 6 weeks for complicated. That's a long time.
It is. The source does note that shorter courses, maybe just 3 to 4 days, are being investigated for uncomplicated UTIs, potentially being just as effective, but 7-10 days is still the more common recommendation currently.
Good to know research is ongoing there. So, after the antibiotic course is finished, how do we know it worked? Is follow-up needed?
It depends. For uncomplicated UTIs, if the clinical signs resolve completely and don't return after stopping the antibiotics, we often assume the infection is cured. No routine recheck culture is usually done.
Okay, signs gone, assume it's cleared.
Pretty much. But for complicated UTIs, follow-up is more critical. The recommendation is often to continue therapy for about 7 to 10 days beyond the resolution of clinical signs and any evidence of inflammation on urinalysis.
A bit longer, even after they seem better.
Yes. And then, crucially, perform a repeat urine culture about 7 to 10 days after stopping the antibiotics to confirm that the bacteria are truly gone.
Okay, culture confirmation for complicated cases. What about prevention, especially for those pets that seem to get recurrent infections?
The cornerstone of prevention is really identifying and managing any underlying conditions that are predisposing the pet to UTIs. Fixing the root cause, if possible.
Right. Address the risk factors.
Exactly. For pets with recurrent infections where an underlying cause can't be fully managed, there are some other strategies, though.
Like what?
One is a medication called methenamine. It gets converted in acidic urine to formaldehyde, which inhibits bacterial growth. It often needs to be given with something like ascorbic acid, vitamin C, to help keep the urine acidic.
Interesting mechanism.
Another approach, used cautiously, is low-dose prophylactic antibiotics, giving a small dose of an antibiotic daily long-term. But there's a significant concern about promoting antibiotic resistance with this strategy.
Yeah, that's a big concern.
It is. And then there's cranberry extract. Some evidence suggests it might help prevent certain bacteria, particularly E. coli, from adhering to the bladder wall. It's often considered as an ancillary therapy.
Cranberry, yeah. Often hear about that. Okay, we've covered a lot. Are there potential complications we should be aware of if a UTI isn't treated properly or becomes severe?
Yes, definitely. A lower UTI can potentially ascend up the ureters to the kidneys, causing pyelonephritis, which is a kidney infection that's more serious.
Kidney infection, right.
We also mentioned UTIs, especially with those urease-producing bacteria, can contribute to the formation of struvite uroliths, or bladder stones.
Stone, yeah.
And chronic inflammation can sometimes lead to changes in the bladder lining, like polypoid cystitis, which involves inflammatory polyps forming.
Okay, so potential for kidney issues, stones, and chronic changes. But overall, wrapping up the prognosis.
To reiterate, for uncomplicated UTIs, the prognosis is generally considered good to excellent with appropriate treatment. For complicated UTIs, the outlook really hinges on the ability to successfully manage or resolve the underlying predisposing cause. If you can fix the underlying issue, the prognosis for the UTIs is usually good too.
That's great context. So let's recap the big picture. It sounds like UTIs are, well, surprisingly common in our pets, particularly if they have other health problems.
Definitely more common than many owners might think.
And while symptoms like frequent or painful urination are clues, they aren't proof. You really need diagnostics, especially that urine culture,
The culture is key for confirmation.
and the sensitivity testing to guide treatment effectively. But the good news is that effective antibiotic treatments are available.
Yes, especially when guided by that culture and sensitivity data.
Absolutely. And the bottom line for listeners, if you have any concerns about your pet's urinary habits or health, the best thing to do is
Talk to your veterinarian. Always the best first step for diagnosis and proper treatment.
couldn't agree more.
Mm.
Okay, before we wrap up, here's a final thought for you to chew on. We hear a lot about antibiotic resistance in human medicine, a growing global concern.
A huge issue.
So thinking about how we use antibiotics in our animal companions, what are the potential implications for this larger resistance picture? And what role can responsible pet ownership play in helping to safeguard the effectiveness of these crucial medicines for everyone, human and animal alike?
That's a really important question, something for us all to consider.
Definitely some food for thought. Thanks for diving deep with us today on Pet UTIs.